All right, I always like to start by surveying my audience. Who works for an employer with more than 50 employees? 2/3 of the room, okay. Who works for an employer with more than 500 employees? Smallish number, okay. Second question, who watched the debate last night? Hopefully everybody, right? Or if you're in business, you're in politics, right? Does anybody think that the amount of regulations that we are going to face is going to lessen, or do we think it's going to grow based on the results of the debate last night? Exactly. So there was a layup question that Lester Holt asked. The very first question was, how are you going to grow the economy with well-paying jobs? Hillary had an easy answer. I'm going to continue to grow the government at a very rapid pace, just like my predecessor. Thousands of new jobs. Average salary for a federal government employee is north of 70 grand, right? So those are great, well-paying jobs. Trump also had a layup and said, he could have said, how many jobs have you created? He'd have lost because they've created a lot of jobs, right? So we're expecting massive growth in the federal government. Our goal today, we're gonna understand what's going on. Who's been to an ACA talk? Everybody, right? It's old, it's tired, it's boring. So I'm going to make this kind of update. How do we cope with the law now that it's out there, and some new ideas on potentially saving some costs. We're also going to talk a little bit about an insurance product to deal with this wage hour. It's not a great product. It's kind of a saving grace for larger employers. Those of you that identify as larger employers, there's an opportunity for you there. There's also a product out there everybody should be aware of called Employee Practices Liability Insurance. It pays for these guys' defense costs. You need to have that product if you haven't looked at it already. We're also going to introduce some strategies on cost control, and we're going to talk about what I just said, risk mitigation of this wage hour world. First of all, I like to level set. I'm trained as an economist. I look at macro issues. So a macro issue is this. We're at 5% unemployment, right? Forget the folks who have dropped out of the labor force and said, I'm not going to try anymore. Those folks that are trying to get jobs, we're at 5%. Most people would consider that full employment, right? If we think about supply and demand, when we're at full employment, what's happening to wages? Wages are going up, right? So we've talked about the fact that from a regulatory environment, wages are going up. We also know that we're going to have to pay overtime to folks we probably never paid overtime to before. So that overall cost of wages and employee is going up, right? We also have costs of things that you buy for your employees. Earnings has gone up about 54% over this period that we're measuring. Look at workers' contribution to premiums and healthcare costs, right? So a significant dynamic cost associated with employees' wages as well as insurance costs. And that's the world that I live in every day. Unfortunately, the pie for a lot of employers is not increasing from a revenue perspective, right? So we've got relatively flat GDP. From a macro perspective, companies aren't growing their top line revenues at excessive paces. So something's got to give, right? What is growing, and this is a little laughter, some of those logos you've already seen in Seth's presentation, actually. We've got Americans growing at a fairly rapid pace. 35% of us are obese. Healthcare spending is now approaching 20% of GDP. We spend more on healthcare than any other country in the nation. And the burden on households, so now you guys have, the pie is not getting any bigger. You've got wage costs going up. You've got benefits costs going up. What do you got to do? You got to shift costs back to your employees in the form of shared contributions on things like healthcare. I also want to just reiterate what we've already talked about, which is government is growing at a fairly rapid pace. We passed this revolutionary law in 1965 called Medicare. Most CFOs back then said we can never survive it. We got to give 7% of wages to the government to cover health care of retirees who don't even work for us anymore. We survived Medicare. We survived ERISA. We survived COBRA. We survived HIPAA, which Seth mentioned earlier. HIPAA, little milestone in HIPAA, gave us something called the Interagency Guidelines. That basically gives every federal agency cross-policing authority for the other agency. So if DOL happens to be paying you a visit and they see something they don't like, they can call HHS, they can call IRS. They have cross-policing authority. That came inside of HIPAA. We got Medicare Part D, right? That was a big deal, but we all survived it. Then we got the Affordable Care Act. And again, in my industry, when the United States Supreme Court affirmed the Affordable Care Act as a tax, I was on a really expensive vacation in Hawaii with my family. And I thought, okay, my world is crashing down around me. The government is taking over healthcare. I'm going to be unemployed. I have no idea I'm going to pay for this vacation, but let's party on since we're here, right? Good news is employers are calling me more and more and more because the ACA is a confusing mess, and it's actually my stock has risen. We read a lot of surveys in our world, and I'm sure you do too. This is a survey done by the International Foundation of Employee Benefit Professionals, right? They surveyed them and said, of 598 of you, what are your biggest issues today? And as you can see, administrative issues, dealing with complex regulation that we've talked about, right? 57% of them said that. The next 21% said costs, and then plan design and all the other. But again, folks in your world, whether you're an accounting professional, an HR professional, or some other person in business, the administrative burden is becoming an issue, right? If it hasn't already been an issue. Coverage mandates, just to reiterate, I think everybody knows this now, but for the first time ever, the United States federal government has passed a law that says you have to buy an insurance product, right? If you don't buy it at work, you have to buy it individually. So there's an individual mandate. Sometimes people say to me, well, you've got to buy auto insurance. People in New York City don't buy auto insurance because they don't drive cars, right? You have to be insured as an American citizen or actually a visiting person from another country. You have to be insured today. Employer requirements, again, we're not going to spend a ton of time on the ACA because hopefully at this point in time everybody knows. But two things you got to do as an employer. You got to offer a minimum value plan, and in the government's wisdom they decided 60% is minimum value, 60% actuarial value. And who knows why, but essentially what they're saying there is if you offer a health plan, roughly 60% of the costs that come into that health plan have to be paid by the plan. The remaining 40% can be paid by the participants in the plan. So that's minimum value. You also have to make it affordable. And affordability by the government standard is they think it's okay for you to pay up to 10% of what you make individually for health insurance. So let's think about that. If you're out applying for a mortgage loan, your loan officer is going to say, okay, let's look at how much you make and look at how much house you can afford. And the rough rule that the mortgage loan officers use is 25%, right? So you can spend about 25% of what you make on a house. The government, in their wisdom, has decided you should spend another 10% of what you make on your health insurance. It's a growing number. The individual mandate, we just want to remind folks that if you're not buying it through a group plan, most of us still buy it through group plan, the cost is going up to be uninsured. In 2016, it's $700. It's set to go to over $1,100 by 2018. So it's going to get painful to be uninsured out there. We also like to just remind folks about the IRS reporting responsibilities. How many people had a really good time filing forms 1094 and 1095 last year? Who outsourced it? Who hired someone to do it for them? You guys recruited some poor sucker to do 1094, 1095 inside. This is your job now. Yeah. So we had a lot of employers who were in denial. We represent a lot of hospitality, a lot of restaurant. I had one restaurant owner who they make pitas and things like that. You may have eaten there. They said, well, we don't have to do this, right? No, you do. You have 400 employees. You do. They were in denial. A lot of employers were in denial. But what I suspect that a lot of employers realized, and again, Seth and John both alluded to it, is technology is going to become your friend. You need a payroll system and or a tracking and monitoring system because you need to be able to identify full-time in the ACA world isn't 40 hours. Full-time in the ACA world is 30 hours, right? And you got to track over a period of a year. So again, technology should be your friend if it's not already. You need to be able to track so that you can report accurately. Because just like DOL and this new FLSA rule, the ACA is a revenue enhancement rule, right? We're going to talk about what they're looking to enhance revenue. We're going to do some quick math for the CPAs in the room. Access to health insurance in 2010, when the law was passed, the government would have led us to believe that, fully half the country was uninsured. Unfortunately, it was only about 16% of the country that was uninsured. 48% of us were getting it from an employer, right? The vast majority either get it from an employer or get it from Medicare. We also have a significant portion of the country that's on Medicaid. Circa 2018, let's look how things have changed. Medicaid has expanded. I think everybody's kind of aware of that. In Ohio, our governor decided Medicaid should be expanded. Medicare hasn't changed substantially from 14 to 19. The employer-based plan hasn't changed a lot either. Circa 10, it was 48%. We're expecting it's going to be 45% in 2018. The uninsured population has gone down substantially, but look at the net change. We had 16% uninsured in 2010. 4% of them got it through the public exchange. Where do you think the rest of them got it? Medicaid, that's correct. Big, massive state federal program. Wait for later in my talk. We're going to talk about costs and who's bearing them. But essentially, who pays for Medicaid? Raise your hand. We all do. Yes, sir.
Because of the requirement of ACA that employers have to provide it, wouldn't that make the employer-based coverage go up?
Yeah, that's a great, yeah. So question is, the law says as an employer, a large employer of over 50, you have to offer insurance. Why wouldn't more people be getting it from employers? Why wouldn't that share of the pie be going up? The answer is that employers are smart, and employers have identified ways to get their low-paid employees. They still make them the offer. So I'm talking about my restaurant employee, where someone makes 19 or 20 grand, right? Now they say to that employee, yeah, you can have our plan if you want it. It's $460 a month. You only make 20 grand a year. Can you afford that? Well, no, I've made it affordable, but again, you can't afford it. So now that employee goes and gets it on Medicaid. And that's what we're going to look at here. Shocking statistic I think most people aren't aware of. This is not Medicaid, but this is the federal exchange and what premium credits or subsidies are available, right? I don't think most people realize, but if you're a family of 4, you can earn up to $97,000 a year and still be entitled to a subsidy in the federal exchange, right? Does anybody in the room think someone who makes 100 grand ought to get a federal subsidy for their health insurance? That's how this program is created. So let's talk about the Medicare challenge. And this is, again, I'm teeing it up for, what do we start with? Too much or, well, depending on your impression. I think too much government, but a lot of government, right? More government to come. So in 2000, 39.7 million people on Medicare. Look at 2050. 92.4 million people will be on Medicare in 2050. Right now, we've got roughly 8 workers paying for every Medicare recipient. In 2050, 2.2 workers for every 1 Medicare recipient. What do we think is going to happen to taxes, guys? Underwriting small group, I'm kind of bouncing around here, but just to kind of set the stage. For those of you employers that raised your hand as relatively small employers, the underwriting world kind of changed for you. You used to file medical forms, maybe Form Fire, maybe Easy App, maybe a paper form, where you would ask all of your employees to tell me about your health status. If you're an under 50 employer now, you're not telling us anything about your health status. You're all pooled together in something called modified community rating. So if you happen to have a group of marathon runners who are extremely healthy, and I happen to have a group of construction workers who smoke and drink and look like the guy with the tattoos, we're paying the same for health insurance. Really good system. Let's talk quickly. Can I have a CPA raise his hand in the room? Somebody really quick with math, all right? Here we go, guys. So I'm gonna go through these next slides relatively quickly because Seth only gave me 15 minutes, right? So, all right, thanks. So these are the costs associated with the Affordable Care Act. $849 billion of exchange subsidies. We talked about it. You can make almost 100 grand and get a subsidy in the exchange. $847 billion in Medicaid expansion costs. Again, think back to that round chart. How many people are getting it where? Federal exchange and Medicaid is where people are getting it that didn't have it before. What's that equal roughly? One of our CPA friends, 1.7 trillion. 1.7 trillion, we're close. All right, now we're gonna talk about revenue sources to pay this $1.7 trillion bill. So we have things that are really weird called Medicare unearned income. If you're at the top of the income chart and you stopped paying taxes, Medicare taxes, that changed. Now you're paying taxes up to a much higher level. Payroll taxes gonna raise us $317 million. There's individual and mandate penalty, $55 million. The Cadillac tax, put that one on hold because it was set aside until 2020. So don't add that $111 million in. One of the math guys in the room, the CPAs, help me keep a tally. So right now we're at about 410, 415 million. 3.8 million in PCORI fees, 25 million in reinsurance assessment fees, provider tax, that's all the insurance companies paying, 101 million. Permanent risk adjustment, small amount, it's not even added in. What's that? Where are we at on our total, guys? Anybody? 500 million, good round number. Tanning excise tax. Anybody like to go to the tanning bed? If you're a tanning bed operator, you're now paying 1.5% of your revenue as a tax to support the Affordable Care Act. Isn't that fun? 34.2 million for prescription drug branding. If you like medical devices like our friends at the Cleveland Clinic do, there's a $29 million tax and another $100 million for employer shared responsibility. That's coming from the employers who choose not to sponsor a good plan and they have to pay a tax. Add it all up, whoops, that's not the right slide, let's go back. Add it all up, it's a $1.7 trillion law and there's less than a half of that amount paid for by the revenue that's generated inside the law. It's not a self-sustaining law. Where's the rest coming from? It's coming from all the stuff my friends have already talked about. Department of Labor is going to enter into a very aggressive revenue enhancement strategy. Some employers said, and again, I'm jumping around in slides, but these are kind of value add slides. Some employers said, maybe we should just pay the tax, right? The tax is only $3,000, so let's just pay the tax. We did a calculation for employers early on, and here's kind of what we look at. If you are paying for premium, that's a tax deductible expense, right? If you leave healthcare altogether and let your employees go to the exchange, and those that are making less than 100 grand get a subsidy, we talked about that. The annual salary of this employee happens to be 100 grand, run it all the way down, and essentially the tax burden to the employer for not sponsoring a plan is 8 grand plus the tax, which isn't a tax deductible expense. So most employers can buy health insurance for under $11,000 and think about the attract and retain. We talked about 5% is full employment, right? So imagine you're that employer when you're interviewing your new employee and they say, so tell me about your health insurance plan. You say, we've got a great strategy. We send our employees to the exchange because you can get a subsidy up to 100 grand. And then they interview with the next employer and they say, we have a plan and we pay for it and we make it affordable. I think that employee's probably going to work for employer B, not employer A. So, and yes, I'm in the business to incent people to buy insurance because that's what I do, but we think that that's going to be a strategy most employers are going to want to continue. Real quick, let's talk about some strategies, long-term solutions to deal with this. How many of you in the room are self-insured for health insurance? Small number. I would tell you that if I asked that question 5 years from now, I would expect that the number of self-insured employers is going to go up substantially. It's a way around some of the negative associated with the Affordable Care Act. Even a small employer who was self-insured can underwrite. So if you're that under 50 employer with the marathon runner group, instead of being pooled with my bad group, you can stand on your own if you're self-insured. We're also going to see consumer-driven plans grow. Wellness programs, who has a wellness program? Be careful with your wellness programs. There's new penalties associated with that under another federal law called the EEOC. So you got to make sure that your wellness programs pass the test of EEOC, and you can incentivize, but not that much anymore. New approaches to buying services, we're going to see all kinds of that. These slides kind of get boring because I put them together in a really quick hurry, but why would I self-fund? We minimize our fixed costs through self-funding. We have data transparency. How many of you have sat down with your guy like me, your advisor, your broker, and said, tell me how much of my $1 million premium that Medical Mutual spent on claims? And your guy looked at you and said, I can't tell you that because Medical Mutual doesn't tell me. When you're self-insured, it's completely transparent. I can show you exactly what was spent on health insurance, on fixed costs, on taking care of your people. Control benefit plan costs. Basically, we have unlimited flexibility when we're self-insured to control the plan design, so we can do whatever we want with it. The insurance companies kind of minimize the flexibility that you have these days. And then finally, we've got national plan consistency. We've got a new law that ERISA regulates our plan instead of the state insurance laws. We also have better cash flow. We can partner with best in class, so we don't have to just pick this network or this third-party administrator. We can pick any one that we want. And that's just some of that. And then we can also employ a program. There's several brands out there, but Health 180 is really kind of a wellness program on steroids. So for those of you that are testing for things like cholesterol and glucose, Health 180 and programs like it around the country are expanding your ability to help your employees manage costs. About 80% of the costs that are driven into any health plan are related to modifiable behaviors of your employees. So wellness programs do work. I know they've been bad wrapped, but it needs to be a wellness program on steroids is what I like to call programs like Health 180. Large employers do use self-funding, so as you go up the spectrum, very large employers, almost all of them do it. Why do they do it? Because it makes sense from a cash flow perspective. Funding mechanisms, we're using a lot of something called a captive today to help employers that are smaller and they wouldn't otherwise have the opportunity to self-fund. But by joining those employers together in a captive pool, and it's a local captive right in Westlake, Ohio, called Roundstone is one of the ones we're partnering with. We've been able to take employers with 20, 30, 40 employees who could never look at self-funding before and self-insure them and give them the advantages that we talked about. Cash flow, transparency, the ability to implement great medical management programs. How the captive works, I like to liken it to a layer cake. So you would take risk at the lowest level, that black lower left corner. Then you share in risk with the captive. So the next layer of the cake is you and several other like-minded employers from around the country sharing risk. And then the third layer is we reinsure it out to a large insurance company. So a captive can be a really viable, that black layer down the bottom, you can dial it up, you can dial it down. Each employer can pick and choose how much risk they'd like to retain. The group captive trend, we've seen it get very, very popular. More employers are looking at captives or other self-insured mechanisms. There's other cost containment strategies that we can incorporate into them. Things like early detection, we talked about advanced biometric screening. So that's taking that normal biometric screening that you're doing at your workplace and adding about 45 more test values to it, providing that as an executive summary to a physician and letting them get after things far earlier than just, hey, you've got high cholesterol, let's get you on a statin. Okay? So it's really useful in terms of long-term management of health conditions. We do things like claim audits. We also have programs to take out some of the high costs. One of the fastest growing areas, and I think most of you have seen it on the news, is prescription drugs, right? So by self-insuring and using a captive strategy, we can carve out that prescription drug cost and do a better job of managing it as well. Here's just some information on the advanced biometric screening and what we look at when we're doing that. There's 49 points of things that we look at. So we don't just look at heart disease. We look at liver, we look at kidney, we look at diabetes. We basically think about the Cleveland Clinic's executive physical, which costs about $5,000. We're able to bring that down to an employer-employee level for $100, right? So it's a pretty close proximity to an executive physical for about $100. Here's a real-life example of an employer that we did. It was a hospital in the Midwest. This is not my client, but one of Roundstone's clients. And they've actually seen a reduction in their medical cost trends over the last couple of years. Other health insurance options to consider. Who's heard of the MIWA? Anybody that's been in the health insurance or legal business for more than 20 years has probably heard of a MIWA because it kind of falls under everything old is new again. So back in the day, we used to have these things called MIWA, which is a multiple employer welfare association. They typically were sponsored by trade associations like COSI or the Builders Exchange. They went away because they weren't properly designed and reserved, and the Department of Insurance basically said, we're outlawing MIWAs because employers need to be protected. Guess what? With the Affordable Care Act and Mother of invention, the whole thing is we need new solutions. So MIWAs have come back into the fray. COSI is offering one, Anthem is offering one. My trade association on which I serve on a board, ABC, is offering one. I would encourage you to look at them. It's a form of self-insurance. Be careful because there is some back-end liability in some of the MIWAs where you could essentially have some surprises. Be careful. So they're a good vehicle. They're not for everyone, but I would encourage you to look at them because they can save you money and also help you control. They've got the same advantages of a captive and the transparency and the ability to be flexible in your design. Fully insured versus self-insured. There are some self-insured MIWAs out there. There's only one fully insured that I'm aware of. It's offered by United Healthcare through a trade association partnership. Other benefit offerings that have gained popularity to push off of your payroll and onto the employees, right? Voluntary benefits are the fastest growing, and all of these things are being now offered on a voluntary basis. I wish I had pet insurance. I just spent about $3,000 on my dog last week, and it was all on me, unfortunately. Benefit industry trends, we talked about more voluntary offerings. Exchanges and defined contribution models continue to gain popularity. HSAs continue to grow. Technology, again, that's going to be your savior over time. Technology to manage wage hour, technology to monitor health. Technology is going to be our friend, and it's going to play a bigger and bigger role in your relationship with your employees. And there's going to be all kinds of new apps. There's apps on your phone. We talked about an app that the DOL now has where you can actually report your own wages and hours. There's apps for health management. There's apps for enrollment. We're going to see that grow as well. We're going to talk real quickly about wage hour claims. One of the things Seth asked me to cover because it's very relevant to the topic. So claimants filed more than 8,900 Fair Labor Standards Act cases in the federal court last year, right? So these are either class action suits or individual suits. It's a 30% increase. Most EPL policies don't offer coverage. So as I said before, if you don't have an EPL policy, you ought to be looking at it, but don't be looking at it for fair labor standards. Look at it for age discrimination, wrongful termination, any of those other things where you can get yourself in trouble and need the help of these guys. The reason you want the policy is because it'll pay for your costs of defense. Most times you're either settling or the suits are dismissed, but you still got a big bill from these guys to help you out, right? So what you need is EPL coverage to cover the costs of defense primarily. Wage hour claims, there's 2 insurance options available. You can endorse it to your employee practices liability. So if you don't have EPL, you can't get wage hour coverage. If you do have EPL, you can buy an endorsement. It only pays for defense costs. It is sublimited, and what does that mean? Sublimited means you take on a bunch of your own expense first, and then you can pick up some protection. Again, if it's a class action suit, you're looking at massive costs to defend that. So this product would pick up and help you pay some of those costs. It can also help you pay an award if you have to if you lose in court or you decide to settle. These limits are available to pay those awards as well. There's also some specialty wage hour policies, but those are typically available to very large employers. So raise your hand if you're more than 4,000 employees in the room. Right, so if you're over 4,000 employees, there's some products available to you. The rest of us are going to end up being stuck with just buying an EPL policy and buying an endorsement. And that is the extent of my 15 minutes.